Okay, so from the nursing students book, it is writing number 23. For medicine students also, it is writing number 23 from their book. And for pharmacy student, if you go to the folder of writing to a group of people, you will find a file which is the writing assignment for threadworms. Okay. This is the stimulus material for nurses. In a while, I'll bring on screen the stimulus material for pharmacists as well. So the initial notes will give you information about who you are and the context. So it says you are a school nurse at Toohey Hill Primary School, where there is an outbreak of threadworms. You have to write a general letter of advice to the parents, writing about common symptoms, identification, occurrence, treatment, medication, and hygiene relating to threadworms. Now we have got all the information here. Okay, this is why it is known as fact sheet. All the factual details about disease condition will be given to you. What are the common signs and symptoms of threadworm? How do they look like? How common is the occurrence? What treatment can be given for threadworms? And what are the hygiene measures which the parents or the children or the students need to follow to prevent cross infection? And then it says, using the information provided, write a letter addressed to parents of students at Toohey Hill Primary School, providing information on threadworm and its treatment. Now, similarly, it can be for head lice, it can be for osteoporosis, it can be for flu vaccination, it can be for treatment of burns. And what you need to keep in mind here is that you are writing to a group of people. You are not writing to a technical person, right? When you are writing a referral letter, it is a different story. You are writing to another health professional, and therefore it is okay to use technical language. But when you are writing to a group of people, you will not be using medical jargons, you will not be using technical language, you will be using non-technical language. So the two most common sentence structure or the two most common type of tenses that you will be using in such letters will be simple present tense. As we discussed earlier, simple present tense is used to describe fact. And here, when you are describing the signs and symptoms, when you are describing the occurrence, you are describing all the facts. So the most commonly used sentence structure in writing a letter to provide information will be using simple present tense, active and passive voice. And when you'll be giving instructions to them, you'll be using a lot of modal auxiliaries like you should, you can, must, maybe. So those are the two basic tenses that you are going to use when it comes to writing a letter to provide information. Now, if we look at the same topic, if the same topic was for pharmacist, how the case notes would look like. Okay, this is how the case notes would be if it is for pharmacist. Usually, for pharmacist, the information that you would include in your answer would not be too much, but the case notes or the stimulus material may look like very lengthy, and it can be very time consuming for you to read and extract the information. Okay? The selection of information for both nursing students and pharmacy students will be the same, but the stimulus material which is there for pharmacy students would look like a very lengthy stimulus material with a lot of detail in it. So one habit which all the pharmacy candidates need to develop is to to be able to exclude a lot of irrelevant information and to be able to pick up the crux of the matter, the important things. So here it says you work at a pharmacy in a suburban area where lots of families are with young children, and these families have requested you to provide treatment for threadworms, and that is why you are writing a letter of advice to your customers with young children. Again, the purpose is same: common symptoms, identification technique, hygiene, treatment, and medication. Okay, so the signs and symptoms are given here. The same symptoms are given, but in a very detailed manner: stomach pains, urinary tract infection, how they can be found outside surface of feces. They look like cotton thread. Okay, how common is occurrence? Is more common in crowded living condition, warm weather. What is the treatment? So because obviously for pharmacy the most important aspect is treatment. So you have all the different types of products available, okay, along with the names and how they help, how this product works. So the work pattern of the product or the ingredient is also given. The indication, contraindication will also be given. Right? It can be given to 5 to 14 years. Then other adults can also get affected due to cross infection. Whole family should be treated at the same time, and a repeat dose after 2 weeks of the initial treatment. The hygiene measures to be followed: okay? Morning shower, making sure that they use different towels and face clothes, changing night clothes and underwear, vacuuming carpets, changing bed sheets, keeping nails short. So these are the hygiene measures which you will have to instruct to the parents. And then this is the medication. So even for medication, see, there is a quite lengthy information given. Combotrin 1 are available in chocolate squares where there is no gluten, no artificial color. The content of the medication has been given. The dosage is given. But as far as you are writing to the parents, okay, parents will not be deciding the dosage. You will be instructing them to contact the pharmacist for appropriate dose. So you won't need to give this information about the dosage of it. Then when not to use, if it is pregnancy, and it should not be given to children younger than 2 years. And it's very clearly given. If you are unsure about either of these restrictions, then consult your doctor. Then there is also chance of allergy and hypersensitivity. So you would be straight away telling your customers to contact you if they notice any such problem. They should be contacting you for the prescription of this medication, or they should be contacting you for purchase. Obviously they will at least contact you for purchase, if not for prescription. So you don't need to give much detail about this aspect. Okay, what medication is to be given, how much is to be given for as per the dosage. But yes, you should tell them that what are the contraindication when they should not be giving it to them, and a general advice that they should be consulting their pharmacist or doctor before taking medication. And it says write a letter addressed to families with young children providing information on threadworm. So basically it is not to tell them how to take medication. As long as pharmacy students are considered. You may also have certain tasks where you have to instruct the patients on how to take certain medication, what are the complications that they have to look for, how much dose is to be taken. But here we are not prescribing medication to anyone. Here we are just giving them information about threadworm. That's the purpose. So we'll not be elaborating much on the medication part in this type of letters. Okay. Now let me share with you the model answer, so you'll be able to understand the format of such letters. So there will be no address because you are writing to a group of people. It will directly start with your parents and carers. I'm writing to provide, and yeah, above this you will have the date of exam. Most of the time it will be date of exam. The date on which you are writing the exam will be the date on which you are writing the letter. Okay. So dear parents and carers, I'm writing to provide information about the recent endemic of threadworms at our school. So here, if you are in community, you would say in our community or in our suburban area, and to recommend certain precautionary measures which can be helpful in protecting your family from it. So first they need to identify, right? So first would be about, firstly, it is important to watch for symptoms such as loss of appetite and mild stomach aches. The worms look like a fine cotton threads up to 1.5 centimeter long and are found on the outer surface of feces. So as I told you, the more common tense which we are going to use is simple present passive voice. Instead of saying you can find, we'll use passive voice, are found. And this is our parallel sentence. The worms look like. So the worms is my subject here, and the worms are found. So both the sentences are in present tense, both have the same subject. So the criteria for our parallel sentences are balanced. Now, every time I have not written threadworms, because I have written the worms. So it's very, very clear the threadworms. Okay. So as the worms are particularly active during night, children may also suffer from sleep disturbance, irritation, teeth grinding, and itching around the anus. Some patients are, however, asymptomatic because it's given some of the children may not have any symptoms, but they can still find the threadworms around the anus or around the outer surface of feces. So this is a brief description of symptoms and brief description of the worms. Then about the treatment. So again, as I told you, the main purpose here is not because so that they can self-medicate, right? It is not for self-medication. It is to provide them information. So the standard treatment is Vermox, which should be given to the entire family. Here we need to have comma because this is further description. So the standard treatment is Vermox, which should be given to the entire family at once to prevent recurrence, followed by a second dose after 2 weeks if relapse is suspected. Please note, this medication should not be given to pregnant women or children under 2. And here you can add one more sentence saying, please contact, if you are a pharmacist, you will say, please contact me for any assistance regarding the medication. If you are a nurse, you would say, please contact your GP or pharmacist before purchasing the medication. So it is definitely not for self-medication. Then about the hygiene measures. So the parasites usually grow in warm and congested living condition. Therefore, house, especially wash areas, should be cleaned more often. Otherwise, there is a risk of transmission to the other family members. It is more common among children, though. Yeah, as far as GP is concerned, you can, and specifically when we are writing, please consult your GP, then it is very clear. So then that is fine, you can use, or you can also say your family doctor. Writing is not about too many short forms, though. Okay, there should not be too many of the short forms. The standard ones, when you are writing about the frequency of medication, BD, TDS, QDS, are fair enough, but not too many of them. Then it is more common among children, though. Okay, so here we have said there is a risk of transmission to the other family members. It is more common among children, though. So it usually doesn't occur among adults. In addition, personal hygiene measures. So here, if you remember, when we discussed parallel sentences, we looked at the gerund format. So here I have used a gerund format. In addition, personal hygiene measures such as having daily showers, washing clothes every day, washing hand before meals, and keeping nails trimmed can prevent cross infection. So these are the measures, and I have written all the measures in a noun form, that is in a gerund form. So actual sentence is this: personal hygiene measures can prevent cross infection. And then the description of it. It is equally important to change linen every week and to avoid sharing it within the family. So because writing is all about writing concisely, not writing too much in detail, not converting every bullet point into sentence, but transforming the case notes into a letter which should not be lengthy than 220 to 230 words. Okay, not lengthy than that. And as I said earlier, this kind of letters are quite straightforward if you as far as the tenses are concerned, because here you will not be using any of the past tenses, right? You mostly it is present tense, usually grow, then instructions will be should be cleaned, there is a risk of. So mostly present and the modal auxiliaries will be used. It is important to, should be given, should not be given. This is the kind of sentence structure which you will be using in this type of letters. So yeah, this is how the letter to a group of people will be written. The ending will be same. There will not be a major difference in the way you end the letter. Okay, it will end in the same way: yours sincerely registered nurse, yours sincerely pharmacist. There wouldn't be a major difference there, but the starting would be different. You will not, probably you will not have the address if you are writing to a group of people, and you'll directly start with the salutation. You can also add a reference line, and you can add a reference line here and write. Again, the reference is not for the patient. So about the treatment of threadworms. So this is how your reference line can look like. Right now, the nursing students have one more such letter in their book, which is about the burns. And for pharmacist student also, in the same folder where you will be able to locate the threadworms file, you'll have one more file which is on osteoporosis. And it is a similar structure where it is written to a group of people. So that is going to be the assignment for all of you today. In the next session, I plan to discuss complex sentences, and we'll be doing some of the practice tasks in that as well during the class, so you can acquire the skill of writing complex sentences. That's all from my side. I'll wait for 2 more minutes if you have any questions. Yeah, in the folder where you will find a folder which says writing to a group of people, in that you will have osteoporosis. The just like threadworms, there is a letter on osteoporosis. So that's the assignment. If you can see the screen here, you will have a folder like this where you have 4 different tasks. One is on osteoporosis, one is on head lice. So you can write both of them. In fact, head lice and osteoporosis, they both are same, written to a group of people. Just don't do this one, Klaxon recall. It is a slightly different task. So I'll be explaining that in detail, but you can pick up any of this. Okay, yeah. Okay, so I'll be seeing all of you on Wednesday at the same time. Bye bye till then.